Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, super excited to have you here because you know why? Because we're bringing very exciting conversations with leaders that are within healthcare that are painstakingly shaping our future. We're really passionate around healthcare innovation, adoption, access, and leadership. And just taking a step back, if it's your first time tuning in, let me just give you a little bit of a tidbit of what we're trying to do here. So we are a healthcare innovation company. We're focused on bringing stories of innovation to life, and the aim is highlighting real people that are actually innovating within our space, that are doing the work, and giving them the platform to share their story with our community. And if you haven't checked out any of our historical interviews, make sure that you hit the subscribe button now so that any of the new interviews come right to your inbox. And as part of our commitment to kind of keep you updated with the latest and greatest advancements, solutions that are happening within our niche, I'm delighted today to introduce our next esteemed guest, Timi Leslie, the CEO of BluePath Health. Timi's an exceptional leader in our field. She's constantly driving progress and innovation over the last 30 years. This isn't something that she's done for the last week. It's been a while. So Timi's made it her mission to help organizations improve not only just their business strategy, their tech innovation, their partner relations, their product management, even their system implementation, which we'll talk a little bit about today, about how we can kind of close those gaps from grandiose ideas to those that are actually getting the work done. And her collaborative approach has really made her a go-to expert in enhancing clinical information sharing and applying these cutting edge ideas. So she's got extensive background of leading government and board-led initiatives, with her expertise really just sort of shining through in the health IT strategy financing, population and community health, electronic health records, and health information exchanges. So we're thrilled to have you with us today, Timi. Welcome to the show.
Thank you. I'm really excited to be here today. Thank you for having me.
Yeah, it's a pleasure to have you. So let's maybe just talk a little bit. Let's dive in terms of what has your attention now? What is your intention? What has your focus?
Well, 3 years ago, we started Connecting for Better Health, which is started as a coalition of multiple different diverse organizations coming together to give a backstop to the governor and other legislative leaders here in California to go forward with legislation to support data sharing in the state. That piece of legislation passed 6 months later. I think a lot of it had to do with our ability to lean in and, really help our legislative leaders and policymakers to keep the gas pedal all the way down to the ground. And 3 years later, we're still together. And in November, we incorporated or filed for being a nonprofit organization. So I think that's just something I am incredibly proud of, and now stewarding as their executive director to, to continue to drive change in the state. And we're not done yet with that piece of legislation. And I'm happy to, fill in your listeners on what it's doing. I think it's the first of its kind in the country, but there's so much more to be done. And making sure that we have governance and enforcement, and that data sharing is actually happening in the state, and holding folks to account, making sure that it happens. So that's a lot of my focus. That's also, in addition, I lead a consulting firm where we work with our clients to be able to put a lot of that data sharing into practice. And we have a policy arm too that we're focused on shaping policy up in Sacramento.
What I'm very intrigued about is I get this grandiose idea and it's been put into play. How do you get all these different members that are on the same team, although maybe they're not all wearing the same color jersey, but they're all on a team, to start rowing in the same direction? Can you maybe take us through your thinking and how you kind of start to move this forward? What are the first steps that you typically take to do that?
Yeah, so I think the first is to make sure that you find common ground. And among these different organizations, they all have different goals and objectives and projects and programs and investments, but where that Venn diagram really overlaps. And sometimes it's a real surprise on where that is, but listening to them, understanding where their goals are and objectives are, and then really finding those key areas where there is that common ground and writing it down and
Mm.
making sure that everybody agrees up front on the vision, that big grandiose idea, and then breaking it down to those little parts on this is what and how we're going to work together on this. And generally, we find being able to kind of keep folks together around what those big ideas are and having them continue to come together, we need to demonstrate for them how their value is actually making a difference. So the other forcing function we always think through is what are the measures? What are those, the dashboard that we put in front of each other to be able to say that, yes, coming back over and over again and working together is actually making change and being able to give that feedback on a regular basis. So I think that's how we start our work, being able to pull together folks and then really putting your head down and doing the work, right? And being able to demonstrate that value. And then not only
What does value look like? Not only just for you, but also for those other important stakeholders. What do they care
it
about?
depends on what we're working on, whether it's a policy change. So we pass legislation or, a lot of work in California is around, or I'm sorry, in healthcare is around regulation. So it doesn't necessarily need to be a piece of legislation, but it's working with the regulators to be able to understand what these new innovations are and how do they kind of think about it? How do they put it into their playbook to be able to ensure that it actually gets adopted at scale? So it's policy, it's regulatory, and sometimes it's just that adoption that has to happen on the ground. And we have a lot of success doing that too, where it might be a new tool or technology, and organizations need to learn from each other. And that's the value too, where they come and they learn from each other, and then they know how to shortcut some of that, long haul implementation that sometimes happens.
Do you really sort of, in a sense, view yourself as this bridge builder? So inside of this whole entire ecosystem, you're spending a lot of time building bridges internally, rerouting, back channeling. I mean, that in
Yes.
and of itself is a lot of energy expenditure. Have you found a way to sort of shortcut, or do you think that's just not, you can't shortcut that? You have to go through the process to be able to do that.
I think, yeah, the chief dot connector is what folks are now calling it. I think I love that. I don't think there's
I
any
might
way
have
to.
to swipe and deploy that, by the way.
I um I don't know if there's a way to shortcut that, but it is meaning getting out of your own corner, and opening up the door and making sure that you're listening and recognizing where you see those bright lights. Like we're constantly looking across the country of who's doing things well and making progress and being able to bring that back here to California so we can learn. So I think there needs to be a real intention of listening and learning and being able to recognize when there's real progress happening. That's probably the way you shortcut, is be able to bring
Yeah.
what's already happened, and some of that hard work has been done so you can follow.
So when you're trying to get little wins right off the bat, just to kind of give a perceived progress to them, and you mentioned about dashboards, can you maybe share an example of something where you had a couple little wins, there was an initiative moving that you guys are trying to move forward? Anything come to mind?
Yeah, we have. So when I founded BluePath Health, it was very purpose built to be local, and where and how can we do a lot of the work that I had been doing for my career across the country and getting on a plane pretty much weekly, and knowing that I was leaving this incredible landscape and folks that needed our help here,
Yeah,
just
yeah.
literally in our backyard. And I've been working in Marin County now for over a decade on safe prescribing, and right now it's called, it was started as RX Safe Marin, and now it's OD Free Marin, which is a great arc to the storytelling. But part of the work there is being able to bring in a youth work group on where and how do we really focus on youth-driven work to be able to stop opioid overdoses in the county. And that has then led to Marin 9 to 25, which is a coalition for youth services, county health plan, schools, all the community benefit organization or community-based organizations to come together and be able to share where they are working, what's going well, where there are gaps, and where there might be some overlap of services. And that dashboard, we are looking at school surveys and what, where and how those survey changes are changing over time.
Yeah.
Also looking at overdose rates. When we started this work, when there was an overdose in the county, we weren't looking at the demographics. We didn't know if it was a youth. We don't know if it's in or out of the county. So we've done quite a bit of work with our epidemiologists, as well as with looking at what data is already being collected elsewhere and bringing that together on a dashboard. And it's been quite successful.
So ultimately, who takes ownership of that? I mean, who do you place the onus on all the parties involved? I'm just sort of curious as to like
I love this conversation.
how the accountability actually happens.
Well, using this example, we just received a grant from the California Accountable Communities for Health initiative that was originally incubated by the California Endowment. And then they were able to collect additional state funds, and we're one of the grantees for that. But this idea of an accountable community is something that I'm really excited about and thinking about where it can evolve, because at least in California, and I think in many other municipalities across the state, and the counties hold a lot of social public health governance. And when you look at schools, for example, and this is something I've been spending a lot of my time on, in order to be able to reach youth at schools, we have to meet them where they are. And the health plans have an incredible responsibility to do that. And yet our wellness centers are generally, if you're lucky enough to have a wellness center on campus, they're generally funded by the school budget. And they're the first thing to be in the chopping block. And that, I think, really tells you a lot, where we as a community need to come together. And I think these accountable community structures allow an organization to be that accountable community, where you have a diffused governance of different stakeholders coming together. But it puts at the same level the county and the health plans to be able to pool their funds to create not only like paying their fair share, but to create a safety net as well. And I can go on and on about this, but I do think this idea of an accountable community for health is something that we should all be paying attention to.
And then, so like a few steps forward, this is going well. What happens then as that's put into place? What do you think some of the net benefits are of that happening? And then what are the blockers that are preventing us from getting there?
Big audacious goal, right? That we all
we want to dream. We want to
but
dream big, and then we want to slam ourselves back to reality to figure out, like, all right, where's the gap, and what's the work that has to get done?
Well, just using this example. So when we started this work, we have a very scattershot of wellness services across all of our campuses.
Yeah.
And they all need to be equal. We need to have equal services across all of our campuses. They need to be robust. Youth need to be able to, if you're lucky enough to capture a child or a youth that says they want services, let's get it to them right then and there. And let's make sure that they are able to access that service right then and there, and not worry about all the BS that's behind it of who's going to pay for it. So if we really are successful in this, I see a way for the community to be able to put their resources in areas where the resources are needed in order to shore up the access to services across the board, so it's equitable. And we're really proud of the way the community comes together to close those gaps.
Amazing. So where you've been talking to a lot of folks around the country, who's impressing you most right now?
Well, I think the work that CMMI is doing is something for us to keep our attention on. Fortunately, I think California, we just haven't really raised our hand as high as it needs to be part of some of their really, I think, forward-thinking work on how to pay for healthcare services. A little bit of that probably is because California has always been a very delegated market, and we know what managed care looks like and what risk looks like. But the way CMMI is doing it at scale, or potentially could do it at scale, I think that's something for us to keep our eye on. The other, I don't know enough about it, but I am doing the research, is that ARPA-H just released an Accountable Communities initiative that they're going to be funding over the course of the next, I think, 8 or 9 months. And they're at the very beginning of it, but we should all be looking at that. I think it starts with populations of 500,000 and above. But just going back to what we were just talking about, I think they're also very focused on this new model of governance that's kind of pulling folks together that all have a share of the health of a community.
Interesting. Interesting.
I
And
should
when
also say, give a shout out to my ONC friends. And then also in California, I'd love to get back to this too. The leadership that's at our Health and Human Services Agency, so working across Health and Human Services, there's a new center called CDII, which is Insights and Innovation, Data Insights and Innovation. And they're leading the work around the data exchange framework, which is the result of the legislation that I talked about earlier.
yeah,
And
let's
I
talk
think
more
they're
about
doing
that,
quite a bit
because
of work. Yeah,
let's
no, I'd
talk
love
more
to talk
about
about
that and your involvement. I mean, share with us to the extent that you're able to.
Yeah, and I think so the work that we're doing with Connecting for Better Health is bringing, anyone who cares about this issue to the table twice a month, to be able to talk about those best practices and be able to lean in around where we want to be able to help shape that policy going forward. We also are just launched the Sandbox, which is the the data exchange framework sandbox. We're partnering with the state of several other early adopters to create a place where it mirrors a real world testing environment of this data exchange framework. And I think for too long, it's been a black box.
Yeah.
And we are uncovering what that black box is. So bringing all the data intermediaries together to understand, if you are, an organization that has an individual who is unhoused, how does that data make it all the way through this framework of exchange to the health plan or the care manager or the PCP who needs to know that that's the new status of this individual?
What was preventing that from happening before? Was it more about like, well, who really owns the data? Like, what were some of those issues that you kind of had to work through just
Oh
to
my
even put
gosh.
the
I mean, I've been
sandbox
doing this
together?
work since the late 90s. We've had several starts and stops. I mean, California is very different from what some of the other states have done, where they've selected a data intermediary to be, or health data utility to be that the traffic cop that gets
Yeah.
the data where it needs to be. We've tried that, didn't work. Stakeholders didn't buy in. And I think this level of having a legislative mandate that you shall exchange information and being able to put social service organizations at the same level of your traditional healthcare stakeholders is a game changer. And one of the force factors I think is really different that we should pay attention to is that we have a single data sharing agreement. And in the past, we've done quite a bit of work on getting everybody around the table, your key trading partners, and saying, yes, we want to do this. But then the discussions really broke down when the attorneys got together and started multiple versions of red lines. And, it's really hard to get, when time passes, to get everybody back around the table to say, yes, we're going to get this done. Everybody joked about locking everybody in the room and not letting them out until they have an agreement. I think that it took us 30 years, but we finally did that.
So now that that's finally done, what could that ultimately mean? And how do you give us some examples of like use cases of how people are using the sandbox now and what some of the outcomes of that have been?
Well, we're just launching it. So
Or the anticipation of it. Yes, the
yeah.
anticipation
So
of it.
our first use case is incredibly remedial. It's An individual falls at home, she's admitted into the ED at a hospital and discharged the same day. And then there's a post-acute discharge, there's a post-acute referral, and then there's messages that go to update both the PCP as well as the managed care plan. Super remedial. But we are also standing up a design studio where organizations can opt in to come in with either their internal to their organization or with others. I would encourage to do it with your trading partners.
Yeah.
And come up with and design your own use cases. And then that'll be part of a library that we will then include synthetic data. So you can pull off your use case out of the library, grab the synthetic data, go and do your own testing, or do it in our community sandbox. And the community sandbox is just going to continue to grow over time with having more and more nodes. So you can really understand when you say you're, procuring a new system. When that happens, you can use the sandbox as a way to test it with those key priority use cases and make sure that you are not alone in this, and get out of that silo, get out of your own four walls so that the data flows where it needs to flow for the benefit of the patient.
That's amazing. Just to even know that that's happening is really encouraging, because the downstream implications of it are pretty significant.
Yeah, I mean, we were looking at it as a way to kind of close that gap, because we saw for the last few years since the mandate was passed, policy advisors, which we adore, they're pushing this work forward, are way up here, and then you have those that are doing the work, the implementation, coming up with the standards, and hopefully coming up with agreement to which standards to use. That was happening down here.
Yeah.
And there's this big, as I call it, this black box of what's happening in between. So the sandbox is really uncovering that, giving some transparency to the work, governance to the work. And hopefully 3 things will come out of it. One is we'll accelerate data sharing in the state, because you have the ability to get on an on-ramp that's risk-free. 2, you would be able to have all these artifacts, shared artifacts, like I just said, like a library of use cases and a library of test data and implementation guides on what standards to use. That all will be generated out of this work. And then 3, my hope is that we have a feedback loop to the state, which is where there might be additional policy work needing to be shored up, or technology and services that need to be invested in.
Well, where are you seeing right now some of the gaps in the tech? I mean, you have to get the infrastructure right. It sounds like if you're building a 50-story building, you need to have the foundation to be able to sustain that type of a building. It sounds like you're really architecting and solidifying that. And then talk about like some of the tech, some of the things that are out there. I mean, there's a lot of noise right now around generative AI and just that in general. I'd love to maybe get like your thoughts. I know you've been sort of down in the weeds and like getting everything done, but like, what are your thoughts as you start to kind of build more of these stories on this building that you're trying to architect and build?
Well, I think the biggest learning right now is that we're still not very far from faxing and secure email and of PDFs. So I think we were talking about generative AI. We talk about
Facts.
fire implementation. Like, it's just all going to be flip of the switch, so easy, and we're nowhere close. So where and how we can leapfrog, I know that's my hope, and being able to have something like the sandbox where we can demonstrate where we are today and where and how we can quickly move forward and maybe leapfrog several steps in the way. But I think that's the biggest learning in tech, is that, we're still really, 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 really 10 years behind where we should be. And also with the being able to pull together these social services, which is incredibly exciting, being able to have food security organizations come to the table, housing organizations come to the table, those providing these really enhanced care management services. Like, we're going to have to make room for them at the table, and also help hold their hands as they are able to get the capacity built within their own 4 walls to be able to jump on and be able to be part of this data sharing. So there's also room there for some real innovation, and hopefully advance, past faxing and PDFing when they start. I'm sorry, but
Listen,
that's the reality.
that's the reality. There's you have to play, you have to understand the brutal truth of where you are, and that's where we've been for some time. The truth is that you've been doing a lot of, not just you, but there's a lot of people that have been doing groundwork, that have been laying down foundational things. And my hope is that um, these seeds that have been planted, this root structure that we're laying down, is going to be able to allow a plant that can grow significantly fast in a short amount of time. I think we're just breaking through the surface, but we're about to see some really interesting times of growth. How can folks, follow your work, follow, the work of your company? Can you maybe just give a little commercial?
Yeah, absolutely. So Connecting for Better Health, connectingforbetterhealth.com. Join us there. You can sign up for our newsletter. We have incredible resources. My team is, A plus for pulling together and curating the resources that are required to be able to really understand where we are in California and where we're going to go. We also get together twice a month, and I would open to anyone who's interested to be able to join us and join the conversation. And also, that's a great place to network. I open up every meeting with, make sure that you introduce yourself in the chat so that the work not only happens in those meetings, but also outside of the meetings. And then we get together on a regular basis at different conferences and, maybe meetups throughout the year. So Connecting for Better Health, please check us out there. We also will be standing up the Sandbox on-ramp too. So if you want to learn more, please reach out to us. And then finally, BluePath Health. So also BluePathHealth.com. That's the consulting firm, and we would love to talk to you.
Amazing. So, we covered a lot of ground in this conversation, but if there was, we have a community of people that believe that we can do better, which means that we have to take action. If you had to sort of distill it down to maybe an action item that whoever's listening into this could do to make change, to make tangible change, like, do you have an action item for them?
Yeah, I fall back on this all the time. It takes two to tango. It takes two to be able to, have data move from point A to point B. So reach out to those key trading partners, reach out to the FQHC, reach out to the food bank, and figure out how you can solve that gap, because I guarantee there's a gap, and do it together. So that's what I would say is, you can't do this alone. It's not solo. It's really lonely when you sit in your office. So pick up the phone and call those trading partners.
Amazing. Timi, thank you so much for today. It's been really nice. And for those that if you've been listening, if you found this conversation helpful to you, would you mind just sharing it on social media, liking it, smash the like button, whatever bell, whatever you're looking at, just make sure that you engage and you comment and let us know how we can support you. So thanks again. We look forward to having future conversations with you, Timi, and see you soon.
It was great. Yeah. Thank you.